What's one thing you can do when your child is freaking out that will make a world of difference? There's a simple solution here. I'm going to tell you what it is, how to do it, and why it works. I'm Dr. Anna Kroncke. I'm a child psychologist, a mom, and a co-founder of the Katie app, a free app for parents that helps parents find solutions to challenges just like this every day in just a moment's time. Your child is freaking out. What can you do? The first thing to do is stop talking. Say nothing. Drop your verbals. Be calm, be present, and wait it out. Why is this hard? As parents, we don't want to ignore our kids. We want to get in there and we want to fix it and we want to help. But there's a reason that this is not the time to fix this problem or to help. It's the time to wait and listen and be silently supportive. When we think about our child's brain and their emotional functioning, we can divide it into two pieces that are really easy for a child to understand, and I think help a lot of parents understand too. So the first piece is the wizard brain. The wizard brain is your child's thinking brain. Think about the prefrontal cortex, the planning and organizing parts of your brain that allow you to have conversations, make decisions, and think rationally. Now let's contrast that part of the brain with the lizard brain. The lizard brain is the part of your child's brain that is driven by emotions. When a child is very upset, their emotional brain, their amygdala, takes over, and that part of the brain is making all the decisions. They're not thinking, they're not planning, they're not listening. And when we talk, when our child is having a meltdown or freaking out, it's likely to escalate or make the situation even worse. So what do parents often ask me about this situation? Well, they tend to say, but I don't want to ignore my child. I also don't want to be stuck in this embarrassing situation where my child is having a meltdown in the grocery store and people are staring at me. And unfortunately, that is a part of the society that we live in. There is some level of judgment when our kids are having a tantrum. And for some parents, this is really hard to do. I still maintain that it is the best thing to drop your verbals and wait. You're looking for signs of calming down that you can then praise. Now, some parents ask me, well, what if my child wants a hug? Well, that is differentially reinforcing. So what that means, when somebody is doing one thing that we feel like is positive, then that is differentially reinforcing. That's a good thing because they can't do the other thing that we view as negative. In this situation, throwing things, maybe the child standing in their bedroom, throwing Legos at you. If they come in and try to have a hug, that means they're not throwing Legos at you. So if you respond by giving that hug and saying, I know this is hard, that's all you say, just a few short words, then you are reinforcing calming down because your child stopped throwing things and they came in for a hug. So absolutely, if you can sit down on the floor and open your arms for a hug and your tantruming, freaking out child will come and relax into you and cry it out, then they're no longer having a destructive tantrum anymore. So I think that's great. Now, I want to talk about this point of ignoring. So we're not ignoring our child, but in fact, we're being present and we're waiting for them to calm down so that we can praise and we can speak with them. So if you notice your child who's freaking out, sits down, buries their head in a pillow, is sobbing quietly, you can say, this is hard. Thanks for calming down. Right? Because you're offering empathy in your voice, you're acknowledging how they're feeling, and you're praising signs of calming down. So again, they're not yelling and cursing at you. They're sitting on the floor with their head in a pillow. So I would not consider that to be ignoring. That is in fact a way that you are giving your child positive reinforcement for the behaviors you want to see. Now, how and what can we praise in these situations? You can look for other signs of calming down. A child might just stop and take a few deep breaths. That's something you can praise. So that's a really important piece. Oh, nice job breathing. That's all you say there. Another thing they might do is they might sit down. Maybe they've been, pacing around the room, throwing objects, and now they're sitting down. So that's something to praise. Another thing you can praise is just if they stop firing insults at you. So maybe your child is saying, I hate you, or you hate me. And you're saying, this is hard. And they stop doing that. And you can say, thanks for being calm. So the more we can offer our child praise for elements of calming down, the better off we are. What if your child hits you or throws things right at you in a way that's dangerous to you or others? So if your child starts to freak out, the first thing I would try to do is clear the space of breakable or dangerous objects. So you're taking things that are near them and putting them on a high shelf, on top of the refrigerator, in a closet. So you're doing that while you're not talking. And that's going to help with the throwing things. If your child is hitting you, you want to turn away and not give any attention for that. With a young child, we're blocking, we're turning away, we're trying not to get hurt ourselves and for them not to get hurt. If your child is going to fall on the floor and kick and hit, maybe you place a pillow under their head. So again, all these things you're doing silently to make sure your child is kept safe. So that's really important. We want to be safe. We want our kids to be safe. But what we're seeing here with some of this hitting, kicking, maybe trying to injure you or themselves, is called an extinction burst. So we're not giving our child attention for something that they do want attention for. And so they are likely to have an extinction burst. They're going to show you more big behaviors before those behaviors drop off. So we have to be patient. With a smaller child, we can pick them up and move them into a playroom, a bedroom, a safer space in the yard, where again, we're staying close by, but we're not going to be talking to them, trying to reason with them. We're waiting for them to calm down, and we're doing that in a safe space. Now, some parents have asked me, well, what do I do if my child runs into their room and slams the door? Well, that could be a good thing. Their room might be a safe and calm space for them. This leads me to want to talk about teaching coping strategies in advance. So when we teach a coping strategy in advance, we're helping our child find ways to calm down that work for them at a time when they are calm and in their wizard brain, not when they're in their lizard brain. So maybe your child likes to take some deep breaths. Maybe they listen to music. Maybe they have a cozy corner in their bedroom with soft things and fidget toys and stuffed animals that they love to snuggle with. Or perhaps you can have an egg chair or some kind of beanbag chair that allows for that comfort and relaxing space. And in that case, I think it's great for kids to take some space and go to their room to calm down. That shows you're really getting a hang of this tantrum, outburst, meltdown situation, and your child is starting to learn some self-regulation. So in fact, if this is a problem that you have often with your child, you should practice and talk about coping skills, talk about what works for you and help them decide what works for them. Do this in advance so that during a meltdown, you might even just cue cozy corner. And then that's all you say at that point. And maybe they take you up on that. Maybe they don't. That can take a while for them to get used to using in the moment, but it's great for you to have that to put out there. So to sum it up, we've talked about dropping verbals, not talking, understanding that when our child is melting down and freaking out, they are in their lizard brain, and we have to wait that out. And I promise you, things can get better. These strategies do work, and they take practice, and they might not be what you're used to, but give it some time. Also visit our Kadey app. You can search for Kadey, Cadey, in the App Store or Play Store and download our free app for parents. We have short videos that teach you how to use these techniques and all kinds of other parenting techniques. You can simply enter an area of concern, the age of your child, and get personalized, specific solutions that work. Kadey is like the doc in your POC. You can pull it out when you need it in the moment, and it will help you and your family's lives to feel calmer and to feel more in control. Parenting is hard, and we're there for you. At Katie, we're parents too. We also have neurodiverse kids, and we understand what you're going through. We're here to help.